Now 6 o'clock.
Any health advice given, whether general, diet, physical, or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum to all our listeners and viewers. I welcome you all to another exciting and educating edition of the Health and Fitness Show. I'm Fahad Matan, your host for today, and I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. I do pray that we all had a nice and positive week so far and looking forward for a nice and positive weekend. This program is broadcasting from the platforms of Inspired FM live today on 17th of December 2020 and casting its positive vibes to all our lovely people in Luton and all the surrounding areas of Luton like Dunstable, Harpeth and Bedford. And our positive airways also reaching to our listeners who are listening us using Inspire FM app or maybe via website, or you can view us if you like to view us from our Facebook live link, which is Inspire FM Facebook live link, or you can view us from our Inspire FM YouTube channel. So yes, this is what it is, and it is a very exciting show today. So many of us know or may not know that this show, I'm doing this show since last. It's now more than 7 years. When I start doing the health and fitness show on Inspire FM, and the main purpose of doing this show is to provide a general community awareness and education to and towards health and social care for our lovely people or our lovely community of Luton. And we all know that we have covered different health related topic every single week, but today's topic is very unique because we will be talking about and try to see from the different vintage point the changes of NHS in last 2 decades. But definitely, as always, I always like to try and start my show with a positive quote. So I like to start my positive show on a positive quote from Hercules, which is the only constant in life is change. Yes, indeed. The only constant in life is change. And without further ado, the topic for today is changes in NHS. Yes, you have heard me correctly. We are talking about changes in NHS, and life is so fast moving. Things, if we talk about the changes last 20 years, the changes which happened last 20 weeks, even in last 20 days, is phenomenal. And 20 hours ago, I just been told that Luton is going into a tier 3 lockdown. So the life is a constant change, and that is very constant. And on this note, let me welcome our guest for tonight who are patiently waiting for me to introduce them. They are well known and lovely, respectable professionals of our health community of Luton. And joining me today, our first guest, let me introduce him. He is a very senior young local Luton GP, and he's known as Dr. He's Manraj Barhey, but very we all call him Baz. Hi, Baz. Baz, your mic is mute. I've unmuted it. Can
Hi,
you hear
can
me?
you hear me now? Yeah?
Yes,
Can you
I
hear me now?
can.
Yeah. Yeah, no,
Good evening.
so thank you for inviting me.
And also our second guest for tonight, he's also well known. He's a professor in Bedfordshire University, and his name is Professor Gurch Randhawa. Good evening, sir.
Good evening, and thank you for having me.
Thank you so much. Thank you so much for both of you to joining us today. And it is it's an honor for me to have you as a guest for on my show. And I must say, when I joined, when I stepped into the field of NHS 10 years ago, you guys were there as a role model in front of me to support me and guide me. So thank you first of all. Before we move further, one of our basic motto of the theme is to ask our guests a bit of introduction about themselves. I know both of you are well known within the community; everybody knows you. But for general people, because it goes through our other platform as well, so people who do not know you, if you give a quick introduction about yourself. Let's start with you, Baz. And I think so. There's a disturbance on your line as well.
On my line? Okay.
Yeah.
Okay.
Anyhow.
Um,
Yeah.
So I've been a GP in Luton now for probably near enough 23, 24 years at Woodland Avenue practice. Did my GP training at the local hospital. So I've been in Luton for a very long time. I'm currently the clinical director for one of the networks. But prior to that, certainly, we talk about change. So around about 2010, 2011, I was the newly formed CCG chair. And even before that, I was actually heavily involved in NHS sort of politics, management type of things. And it's one of these things that really inspires me. Yeah, I like to make changes for the better of Luton. So that's what's kept me going. In my day job, obviously I'm a GP. I'm also a trainer. So we have GP trainers come to our practices. We have upcoming GPs, some junior doctors as well. So yeah, I have my hands very, very full.
Indeed, and yes, definitely. You are busy, and I've seen you. You are also not just busy workly. You are also very actively fit and healthy. And I presume you're going for a football after this show, I presume.
I am straight off the show, straight for football.
Perfect. Now, our second guest, Gurch. Good evening, Gurch, and I'd like you to introduce yourself as well, please.
Sure. So I'm Garrett Trentawa. I'm a professor of diversity and public health and director of the Institute for Health Research at the University of Bedfordshire. I'm really proud to work for a university that's so committed to widening participation. And I think one of the beauties of working for a university that really wants to solve real life problems. So we've been able to create a research program that takes a life course approach. So literally, we've got research programs that focus on issues all the way from preconception, childbirth, maternal health, child health, teenage health, to sort of long-term conditions, looking at elderly care, end-of-life care, organ donation. We run a thriving foundation degree, undergraduate degree, public health master's program, PhD program. And I myself, I'm really lucky that the university allowed me to focus on a range of roles that can help implement our research into practice. So I had the pleasure of working with both of you many years ago at Luton Primary Care Trust, and had the honour of being the chair for nearly 12 years, I think. And currently I'm still a trainer for the Faculty of Public Health, and I don't like the term, but that's what they call it, an expert advisor for the National Institute for Clinical Excellence. And I've just taken on a role as a non-executive director for Forestry England, where we're trying to encourage how the outdoors can be used to help in terms of health and well-being. So absolutely delighted to be here with you this evening.
Thank you so much. And to be honest, it's my honor to having both of you on the show. And let me involve our listeners as well. So listeners, if you have any questions or queries regarding our show tonight, please get in touch with us by sending a text message or WhatsApp on 0779 481822. I repeat, 0779 481822. Or you can send us a message via our Facebook page or from YouTube link as well. So going on to the show, as I said, it's a very unique show, and we are talking about changes itself. So as I said, change. What sort of change we have seen in NHS in last 15 years, 20 years? And you guys are the expert in those areas because you have seen the changes during that time. So let's start with you, Baz.
Well, I mean, I think as Gurch just mentioned, I think we did actually work for each other several years ago, and actually that was one of the times when it went under one of the biggest changes. Now, this is around about sort of 2010, 2011 sort of time. Prior to that, the structure, if you look at the actual structure, was actually quite simple. There were 10 strategic health authorities and some PCTs. Simple as that. Okay, and then the Tory government came along. Mr. Cameron said, "Okay, we can make this simpler with reduced bureaucracy. We can make it clinically led." And we were right in the middle of those changes. And in fact, Gurch and myself worked very hard to keep Luton as a single health authority unit. And then I think it was around about 2010, we became a CCG, Clinical Commissioning Group. Now, the great thing about the CCGs was that they were clinically led. So prior to that, certainly a lot of the GPs, a lot of the doctors were saying, actually, look, how can managers alone run a health service without having clinical input? So to credit to the government, they said, okay, well, let's put the clinicians in charge, and they did. So those CCGs were formed, but we very quickly realised actually, we need management skills. So we sort of morphed into sort of clinical leadership, but also with some great management support. And then we kept our sort of identity in Luton. We became Luton CCG, and we transitioned back in 2010, 2011. So what's happened since then? Well, we were gradually over the years encouraged to work as groups of practices, and we were encouraged to become clusters. So in Luton there were 4 clusters, not really divided by any particular reason, but that practices just got on with each other and they all worked well together. So we had 4 sort of clusters. Then the big change that's happened in the last couple of years is that the introduction of what we call networks. They're called primary care networks. So in essence, we've been asked to work in groups of patient population size of about 50,000 patients, and we were given support and funding to help us sort of work between us. So a couple of years ago, all the practices actually got into a big room, and I had the pleasure of trying to decide or help the practices decide which networks we're going to be in. Then we went from 4 clusters to 5 networks. So we have 5 networks, and they're called PCNs, Primary Care Networks, in Luton. Each network has supposed to have a population of about 50,000, or most of them do. There's 1 or 2 slightly smaller ones. So my network is called Medics PCN, and we have 5 practices, and that covers a patient population size of about 56,000 patients.
Wow.
Yeah. So the idea of having networks, I mean, people keep asking, why the change? Okay, why does the government keep changing things? I think the big driver for the networks was that actually they realised GP practices were under a tremendous amount of pressure. Yeah, and I'm sure all the listeners out there and the patients were saying, yes, it was extremely hard to get a GP appointment, or difficult to actually get anything done. And the government recognised this and said, actually, look, we recognise GPs are under pressure. We have to do something because, quite frankly, a lot of GPs were leaving the profession. A lot of GPs were under stress, and there were some practices that were actually what we term them failing, where the GPs just could not cope with the workload. So again, to their credit, the government said, okay, let's do something about this. So they introduced the concept of networks with the addition of funding. So this is the key thing, because what they're funded is what we call additional roles. Okay, so I won't go into the sort of ins and outs of it, but now what we're allowed to do is we're allowed to recruit between the networks some additional roles. Now these are people such as social prescribers, clinical pharmacists, first contact physios, and physicians associates. So these are people that we could use to take the pressure off GPs. So now, for example, in our network, so far we recruited 2 physicians associates, We've recruited 5 clinical pharmacists who aren't in post yet, but they soon will be. We've got first contact physios, and we've got a social prescriber. So the big difference to patients is that what it means is, say, for example, somebody phones in and say, look, I've got a sore arm or a sore shoulder. In days gone by, there was only one option, and that was, okay, let's try and get in with the GP. But now, we have the first contact physio. So, so the receptionist can book them in there instead. If a patient has a query with a medicine, again, a few years ago, the only option was to go and see a GP. But now they say, okay, no, you can speak to the clinical pharmacist, and they would sort out the problem. So it's about sort of getting, getting the right sort of person to deal with the query. Yeah. We also have physicians associates who, we can use in a variety of ways. They can do minor illness clinics, they can do special clinics in frailty or chronic diseases. And there's a whole variety of ways we can use them. So each network will use their PAs in a slightly different way. But again, it takes pressure off the GP practices, and it helps the GPs focus on perhaps some more of the difficult cases, things that really do take time. So that's the sort of, they're the biggest changes that have happened recently. Now, obviously, we've got to mention COVID along the lines. I think that one of the biggest things to drive forward the networks is actually COVID. Now, in terms of whilst it's a horrible disease and not nice, etc., one thing it has done, you mentioned change. It's actually driven change so quickly that actually, GPs have adapted, they've changed the way they work. And, a lot of the patients will know out there that actually there's a lot more telephone calls, a lot more video calls. But we've actually had to work together, adapt how we work. And I think things have changed absolutely remarkably, since COVID sort of first appeared. I could go on and on, but I probably ought to give Gurch a chance to speak. Otherwise, I'll be talking for hours.
No, indeed, as you have said correctly, that last if we see the last 10-20 years, and if we see the last 10 months and 10 weeks and even 10 days, things are moving so rapidly, and there are new and new things coming up, and then there are questions which has been raised, that what are the research behind it, and why the test and trace need to be done, why COVID vaccine. So when it comes to research, I'll come to you, Gurch. Tell me about the research behind the whole process when we talk about vaccinations and tests and so forth, especially with the COVID.
Sure. So, as I said earlier, we run a public health master's program, and we train students on pandemic management. And as part of my role at the Faculty of Public Health, I train public health practitioners on this. So there are 3 fundamental principles to pandemic management. The first is around public protection. So in the context of COVID-19, that's all around hand washing, social distancing, and mask wearing. That's the first pillar. The second pillar in any pandemic management is around community test and trace. And what's really important with that is it's done locally by trusted providers, and the testing is rapid, the testing is as accurate as possible. The tracing is done locally by people who understand the local geography. And then most importantly, when it works well, the isolation is supported, be that financially or emotionally. So for example, you see in many countries, they've been able to guarantee people's salary protection while they're isolating. And that's the countries where they've had high rates of adherence to testing and isolation. And if you like, the final pillar of pandemic management is the vaccines. So I think the really important thing for listeners to really think about is the vaccine is only one part of a bigger picture. So the public protection is so important, as well as the test, trace, and isolating. And if I can be political for a minute, I think it's fair to say the UK hasn't probably done these as well as others. So we weren't very good with our tailored messaging at the beginning, whereas other countries were very good at developing tailored messaging to encourage people to stay at home, wear masks, hand wash, etc. We definitely haven't been very good as a country in terms of test, trace, and isolate scheme. It's only recently that started to be done at local level, and at local level you're seeing far higher rates of tracing, but still the government haven't financially supported those people who need to isolate. And that's a huge problem in the UK, because pandemics across the world, they mirror your structural inequalities. So they always affect deprived communities the most. That's always been the case. Go back to cholera, the plague, Spanish flu. It's always the case. The poor get the greater impact. So unless we protect those communities by offering them salary protection, so imagine the retail workers, the drivers, etc., we're never really going to solve this. The vaccine, there is a lot of evidence base by it. It's been approved by MHRA. They do rigorous testing. And the only reason it's happened so quickly is the biggest delay normally in vaccine trials is funding. And they have invested a lot of money on this. So I'm not concerned about the efficacy of the vaccine on offer. What I am concerned about is people only seeing the vaccine as a solution, potentially becoming too relaxed, which we all, it's understandable because we all get fed up, staying at home, missing our family, missing our friends. So this isn't about blame, but it's about managing our own risks and managing the health risks of our family and friends.
Indeed, and sometimes it's really hard to create a proper distinction in that sense, especially with now raise of we are now, our third level has now raised to COVID level 3, and tier 3, we are on tier 3. And the trace and test and trace system, we have to go and get ourselves tested every single time, even if we do not get any symptoms. So why the importance of test as such when you do not have any symptoms?
So I think it's important to remember the reason we're in tier 3 is because infection rates have gone up. Infection rates have gone up because it means that, rightly or wrongly, we must all be mixing more than we should be, because that's how this virus spreads. So the reason it's important to get tested is, one, it allows us to then break chains of transmission, and two, as we know, this virus is quite serious for many people. So a lot of people need to understand that if they've got other illnesses, are high risk, especially in terms of age and comorbidities, it's vitally important that they stay at home, look after themselves. And it's not just about physical well-being, it's also about mental well-being. We can't overstate the importance of how difficult it probably is for many people who have, had to completely change their lives since March, both in terms of their work, their family interactions with friends as well. And clearly that has a toll on anybody. So we really do need to support one another.
Indeed, and in terms of Baz, I need your input on that. In regards of the COVID itself, now COVID has brought not just the major issues itself. People who have suffered COVID has and now recovered has a long-term condition health effects as well, isn't it?
Absolutely. I think this is one of the things that has been recognised now as this long COVID syndrome. It's difficult to know where to start with COVID, and there's so much learning that has happened since March. I remember as when all this broke out, I remember at the surgery, it was actually really scary. when you hear of patients, literally, some of the patients you've known for years and years, and you hear of them, they've sadly passed away, and the list of patients passing away was just getting longer and longer. And I remember one day we had 7 patients were notified who passed away. So I remember those were really, really scary times. And also there were patients who were really quite severely ill, and been in hospital for weeks and weeks. But one of the things that's gradually come out over the last few months is that there is this sort of syndrome, the long COVID syndrome, where patients suffer a multitude of symptoms.
Sorry, Bas, I have to stop over there. Unfortunately, we are just going into a break time in a few seconds. So when we come back from the break, we will definitely talk a bit more about long COVID and what we are suffering from and why we are in this pandemic. So stay tuned. We will be right back after these very short messages.
This program will continue after the break. Continue listening to Inspire FM. Inspire FM.
Inspire 105.1 FM.
Assalamu alaikum guys, this is Bilal. Keep smiling, continue building those bridges and keep listening to Inspire FM 105.1.
ये कोरोना वायरस की एक अहम और ताज़ा तरीन खबर है। जिंदगियां बचाने के लिए नई पाबंदियां कौमी सतह पर 2 दिसंबर तक जारी हैं। आप लाजमी घर रहिए। आप घर से सिर्फ फूड, मेडिकल रीजंस, वर्जिश, तालीम और काम की वजह से जा सकते हैं। आप घर से ही काम करें अगर कर सकते हैं। मास्क सवाए जरूरत सफर न कीजिए। ताज़ा तरीन रहनुमाई और निजात के लिए विजिट कीजिए gov.uk/coronavirus। होशियार रहिए, वायरस की रोकथाम कीजिए, जिंदगियां बचाइए।
हसन केटरिंग, शादी हो या सालगिरह या फिर किसी भी किस्म के फंक्शन के लिए हमारी बेहतरीन सर्विस और शानदार मेन्यू से फायदा उठाएं। हमारे माहिर कुक उम्दा खाना बेहतरीन मसाला जात से तैयार करते हैं। हमारी फखरिया पेशकश चिल्टन होटल हाया करने पर स्पेशल डिस्काउंट हासिल करें। अब जदीद तकाज़ों के साथ बेहतरीन हॉल, उम्दा सजावट, आला सर्विस। मजीद मालूमात के लिए आज ही कॉल कीजिए 01582 706666 or visit hasancatering.co.uk.
आइडियल प्रॉपर्टीज 20 साल से आपकी खिदमत में पेश आपकी प्रॉपर्टी की सारी जिम्मेदारी अब हमारी। हम अच्छी तरह से जांच पड़ताल करके किराएदार डालते हैं और आपको किराया बर वक्त गारंटी के साथ दिलवाते हैं। अगर आप प्रॉपर्टी किराए पर लेने या फरोख्त करने का सोच रहे हैं तो आज ही हमारे तजुर्बाकार माहिरीन से राब्ता कीजिए 01582 721110 या फिर 01582 696050। आइडियल प्रॉपर्टीज, आपकी मदद हमारा एन फरीजा।
As winter approaches, here's a critical reminder of coronavirus symptoms from Dr. Gupta.
The main symptoms of coronavirus are a high temperature or a new continuous cough or a sudden loss or change in your sense of smell or taste. If you have any of these, to protect yourself and others, it is critical you isolate at home, even if you don't feel too bad. And you must book a test immediately. Use the NHS COVID-19 app or go to gov.uk/coronavirus.
Stay alert, control the virus, save lives.
Do you want an Islamic education alongside national curriculum for your child? Al Hikmah School for Boys and Girls are your #1 choice. Last year, we had the highest attainment 8 score in Luton, and the GCSE pass rate in Maths and English was 94%. We teach a full range of subjects, where you can gain up to 10 GCSEs. The school is now registered with the prestigious private school body ISA and uses state-of-the-art facilities, including indoor playing area, playing field, brand new science lab, and IT facilities. Call now to apply for your child on 01582 728 196.
We're facing the biggest health challenge of our generation, and we've shown that together we're stronger than ever. But to keep making a difference, we need to support each other. If you're a man and you've had coronavirus recently, then you might just have the antibodies to help save lives in your blood plasma. That's why we urgently need men to donate. Giving blood plasma is safe and easy. Be the difference. Search Donate Plasma or call 0300 123 2323 today.
The Prophet ﷺ said, When Allah had finished his creation, he wrote over his throne, "My mercy overcomes my anger."
From the studios of Inspire FM, the time is now 6:30.
Any health advice given, whether general, diet, physical, or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum and welcome back to another exciting and educating edition of the Health and Fitness Show. I'm your host Fahad Martin for today's show, and I hope and pray that all of us are fit and healthy. And let me welcome you back to the second half of this show. And joining me today, this evening, is our two lovely guests, Dr. Baz, or also known as Dr. Manraj Barhey, and Professor Gurch Randhawa. Good evening to both of you, and welcome and staying. Thank you so much for being part of us. This program is broadcasting live today on 17th of December 2020, and casting its positive vibes to all our lovely people in Luton and surrounding areas of Luton, like Dunstable, Harpen, and Bedford. And you can see and view us using your Facebook Live, as well as YouTube channel of Inspire FM. So welcome back, guys, from the break. And Baz, apologies. I know you were in the flow and have broken your flow, so please accept my apologies in that sense. And before we went on break, you were kindly explaining us regarding the post-COVID problems and issues patients now facing. Sorry, can I ask you to restart from that angle, please?
It's not very often people tell me to shut up, and I do.
So apologies.
So we were talking about the long COVID. Now, it's a lot of people know about the short symptoms of COVID, but you've got to remember that this virus is really quite nasty. Some sort of inflammatory response that affects the whole body. Right from the skin to the brain to almost every part of your body. Now, what we found recently is that there's a whole significant cohort of patients that are actually quite debilitated post-COVID. They get memory problems, they got severe fatigue, joint problems, muscle pain, breathing problems, and it's really, really quite debilitating. And it's only just been recognized. Now, not a lot is known because this is literally a new disease. So even, the GPs and the hospital specialists are sort of struggling to know, how to manage such things. So, we're actually developing long COVID clinics at the moment, and because we know so little about it, we're getting specialists from, the respiratory clinic, we're getting mental health practitioners involved, rehabilitation people. So it really is quite debilitating, but I'm glad to say it's not a majority of people. But there's still a significant number, even in Luton, that we need to organise some sort of service, because this is been on for months and months now, and I'm sure the number of patients with long COVID symptoms will increase over time. So we're learning as quickly as we can and trying to develop sort of clinics appropriately too.
Mm-hmm. And just to add the point on that side, in terms of long COVID clinics, GPs can send referrals to the long COVID clinic if they see that any of the patients suffering from a long COVID. The nearest hub is Milton Keynes service. So I'll speak to you afterwards as well, Baz, in regards of that.
We're looking to develop a local one.
Yeah.
In fact, one of our colleagues, Dr. Abu Bakr, I think everybody knows on this show, is working with the hospital to develop a local service as well. Probably, maybe a community-based one too, but it's in development.
That's brilliant. That's brilliant. So when it comes to research as well, because as Baz said that it is a very new disease. So Gurch, what does the research says? Because we have heard so many times on TV that the science says this and science says that. So how much it been driven from the science and or it's been driven most likely the politicians?
So I think that's true of all pandemics. I mean, especially with coronavirus, because we know it's spread by droplets. We know, therefore, that social distancing is a crucial protective measure. So the challenge in any country is how do you mitigate the risks whilst trying to proceed as life as normal as you possibly can. So if you look at the countries that have done well, and obviously as academics, we sort of scan the world on this, countries I would point out to you like South Korea, Taiwan, New Zealand, they from day one decided that their strategy was all about eliminating the virus. And therefore what they did was quite drastic in that they closed their borders, their islands, and they went into lockdown, and that was tough. For those weeks, imagine closing your international borders, quarantining anybody who then was trying to return back to their country. But I guess they would say it's paid off, because now in the long term, those countries are slowly reopening and returning back to some kind of normal. And I guess that's the important thing. At the same time as doing that, they really did invest in community test, trace and isolate at local levels. So it was the local public health teams, and if I may say, also local GP primary care, who led that and championed that. And we could have done that in this country had we invested the hundreds of billions of pounds in that way. We had a choice. We chose not to make that choice. And in a sense, those countries now, are enjoying pretty much normal life. They're not waiting for a vaccine because they don't need to, because they've suppressed the virus. And I guess that's the political challenge around the world, that you could do that. So, obviously the UK, we're an island, so we could have done the same thing, but obviously government decided that economically was just too much to do, because a lot of our trade is based on imports and exports. And I think that's always going to be a trade-off, and you'll probably see, for decades to come, reviews and research that will analyze different countries' approaches to this. And, and in the midst of this, you've seen huge political change. So, for example, in the UK, you've seen the, continuing growth on Black Lives Matter and the whole push for equality and justice, which is fantastic. You've obviously seen, the big protests in the US sounding around the election and post-election. You're now seeing, for example, in India, the big protests around the farmers' bills. So you've got lots of people who are trying to, in a sense, still fight for social justice, still try and protect themselves from COVID. And, we're having to all navigate trying to live with the virus, but it is definitely a political challenge.
Indeed, and when we talk about all these, and one of the mist of the whole thing, if we talk about 10 months ago that we need a cure for this particular disease, 10 weeks ago we were talking about when is the vaccines gonna come, and 10 days ago we have a vaccine which people are administering and giving, and apparently in Luton GPs, the nearest hospital who's delivering the vaccine is Milton Keynes Hospital, but in Luton GPs already start delivering it, and I think so, Baz, you're one of them, by the way. Did you get your jab?
Interesting. I had it this afternoon. I mean, the way, this is absolutely fascinating how Gurch has already talked about how the vaccine was developed. and it has been due to lack of investment previously. But this vaccine it's been studied in 6 countries, 44,000 patients, very, very safe vaccine. I mean, it's probably one of the safest going. I think Gurch should probably agree with me. And even since it's sort of been out only for a week or so, over 100,000 patients been vaccinated, and as far as I'm aware, there's only 2 people that have had allergic reaction. And now we've put an additional warning on there for not to have patients who've had severe allergies and not to have the vaccine. So to put things into context, it's very safe vaccine, but also it's actually extremely effective. We're talking 90-95% sort of immune response, which is huge. You can put that into context. The flu vaccine, which goes out every year, we're talking 50 to 60% coverage. So this is mega. So in terms of going back to you're asking, is it happening in Luton? Well, the hospitals were the first people to have it, and I think they were chosen because of where could they store the vaccine, and undoubtedly there was a lot of politics involved, but I won't go into that. So logic says why it should have been the Luton Dunsmore Hospital because the numbers are very, very high, etc., etc. But we are where we are, and then we talked about networks earlier on. So this was a good example of actually where networks come in very useful, because networks were asked, do you want to be one of the first ones to start the vaccine program? And one of the networks in Luton, Sunrisers Phoenix, put their hands up and say, yeah, we'll be it. So for the last 3 days, they've been vaccinating, and I went along there today to see how it was all being done. One of the key things is you must prevent wastage, because we cannot let these vaccines go to waste. So today they were short of a couple of hundred slots, so they were soon filled in very, very quickly. And then I volunteered to have mine as well, seeing I was there. So I'd like to reassure listeners that this is an extremely safe vaccine, very effective. It's also absolutely painless, doesn't hurt at all. I think one of the things we've got to encourage, and I think Gurch will agree with me, this all ties in with health inequalities and the fact that COVID has hit the those who are socioeconomically not as well off. It's also hit the BAME community a lot more. Now, what is scary and what I've even noticed in the last few days is all the videos going around on social media, WhatsApp, Facebook. You have people sharing misinformation that completely misguided, completely wrong, and yet for some reason people choose to share these videos far more than anything that's medical evidence. So even today, when patients were coming in, they were still saying, "Well, this is no exaggeration, but I had 2 patients in the last 2 days asking me, what are they going to do with the information they get from the chip?" You may laugh, but this is how influenced people can be. So, it's really, really important. And one of the things I'd like to spread today is, look, for those people who are at risk, please get vaccinated. It's safe, it's effective. Yeah, and if we all get vaccinated as soon as possible, then we're talking, maybe by Easter, early summertime, life could be somewhere near normal. So in terms of the vaccines themselves, as I say, one network put their hands up and did fantastically well. I think this was their last day today. So they come in batches of 975. So each network will get their doses soon. So the patients don't need to sort of phone in and ask about the vaccine. They will get called. Okay. So don't bombard your practices saying, "Where's my vaccine? Where's my vaccine?" Don't do that. You will get called. Okay. And then they all need to be used within 3.5-4 days. So they would need to be done in sort of centres where a lot of vaccinators can be put together. And I'll say it again, it's safe, it's effective. So please get it done, especially those who are at risk.
And apparently, as you said, you already have your jab today.
I did.
Any symptoms whatsoever, as some of the awkward videos viraling?
Absolutely not. No, I'm going for football later on, and I feel better than I did before the jab. But there you go.
And off the record, as Gurch asked, when are we will be having our jobs?
Well, I mean, there is an order of patients at risk. So we're doing the over 80s first, then it'll go down to over 70s, over 60s. So at the moment it's over 80s, and if they can't get rid of all the jabs, they'll ask the healthcare professional workers to have theirs, care home workers, etc., etc. There's still a little bit of debate about whether this vaccine is transportable to care homes, but there's a trial going on in Scotland to check that out. So as soon as we get the go-ahead, then we will all be going out to care homes. There may well be the second vaccine, the Oxford AstraZeneca vaccine, which may get approved. Gurch may know more than me about how far down the line it's going to be approved.
Yeah, Gurch, I wanted to ask you about these two things, because now we have one vaccine, the other one is there, the third one is also on the rise. So there are multiple strains of vaccines. So why there's so many different people making so many different vaccines and they're different from each other?
I mean, the key answer is we need to vaccinate as many people around the world. And in order to get that much dosage, you're going to need a range of vaccines. And interestingly, which I think is really helpful, they all use different technologies to get there. So I think that's a really good thing, which means that, storage limitations won't always apply to all vaccines. I think one of the key points is this issue about misinformation. So I really would like to congratulate you, Fahad, and Inspire FM for your regular broadcasting and information giving to your listeners, and, for example, giving us a platform today. I think that's really laudable, what you're doing. But I think this is the issue, that we need to continue this at many different levels. So at grassroots levels, I think it's vitally important that local public health teams across the country do link up with local radio stations, with community groups, faith leaders, and get the positive, factually correct information out to their communities, because the reach is absolutely huge in those communities. And most importantly, it's trusted reach. And the challenge is, if we don't do it, then you're going to get exactly what Baz is describing. You're going to get people filling in that vacuum with misinformation. So, I would encourage, and I'm trying to work with lots of Sikh organizations at the moment to roll out as much information giving. And I know many people are working with very different faith communities to try and get this out. And I think the important thing is, as Baz has shown, that people need to sort of show some leadership, as Baz has. He's had his vaccine. He's been really open and transparent about how he feels afterwards. And I think the more we can have of that, of people who are, for example, at the moment, anybody who's, ideally, if there's someone in their 90s from, an Asian background who's had the vaccine, it would be wonderful for them to be on this show and talk about how they're okay afterwards, because, they're going to believe them, and they've had that experience of having the vaccine. And even if they've had a sore arm, that's okay. And I think the other key thing is, which is really interesting, I'm glad Baz mentioned it, it's important to remember that any vaccine for COVID that's going to be approved is always going to be more effective than the current flu vaccine. And we don't see problems with people having flu vaccine uptake. So I think it is really interesting that the misinformation is hampering the efforts. And I think it's vitally important that we keep on emphasizing to people how safe and effective these vaccines are. But at the same time, it cannot be seen as a substitute to not socially distance, to not wash your hands and not wear masks. I can't emphasize that enough. Over the forthcoming holiday period, I can see how tempting it will be for people. Shops are open maybe for longer hours. There may be sales on, I don't know. I understand all of that. But what I would say to people is, just for a few more months, bear with, these restrictions, so that you can return back to normality as quickly as possible, because we all want our family and friends to be safe. So, please, please, please stay safe.
Indeed, and that is very, very important in many different ways, because if we cannot maintain our safety, it's really hard for our public health and our health services to cope up with the problems. Cases, Baz, please correct me if I'm wrong, cases in hospital with the positive COVID and serious conditions are getting up with every single passing day, isn't it?
Absolutely. I think today, I think the cases were 31,000, and hospital admissions are steadily on the rise. So, and I'm really scared over the Christmas period. I really think people will, if they don't be safe, those numbers are going to increase. And we're talking, what people don't realise is that we're talking about people dying. We're not talking willy-nilly things. It's people dying. So I'm not sure what is more serious than that. So, for Christ's sake, there's only 5 days. Yeah, the government have allowed it, but as Gert said, I think it's absolutely the wrong move to make. It really is. If anything, we should be saying actually belt up a little bit more, get tighter for the next few weeks while the vaccine kicks in. Yeah, I think that's the strong message I think I would tell people.
Just on the topic of vaccine, please, and I need an answer from both of you. In regards of the current COVID vaccine, which is Pfizer Biotech one, you have 2 dosage. Is it the same thing with the AstraZeneca one? And Gurch, when is the AstraZeneca one is coming out?
So the approval will be down to the MHRA, and I think it's really important to remember that any delays should be seen not in a negative way, because they have to really scrutinize the data in detail. I think it's really important to remember, I think Baz has already alluded on this, these vaccine trials are much larger in scale than most other trials we get for medicinal products. And what's really pleasing, which should offer reassurance to Black and South Asian minority communities, is the diversity of the trial participants globally is much larger on these vaccine trials than any other products we've had before. So on so many levels, we should be really pushing for this. But I can't give you a timeline on when MHRA are likely to approve these products. I wish I had that insight, but unfortunately I don't.
And that will be a 2 dose as well, just like this one.
Yes.
Okay. I love to ask many questions. I have a list full of questions, but unfortunately we are running out of time. So I just have under 3 minutes of time remaining to end this show. So before we end the show, I like a positive quote from both of you. So let's start with you, Gurch.
So, the optimist in me is I would love for the 3 of us, to meet again in person as soon as possible. And I think the only way that's going to happen is if all of us, a country, look after each other. This is genuinely a time for solidarity. And we've all got to stick together and look out for each other. I'm happy to say this, many people know this, my mom lives on her own in Luton, and we won't be seeing her indoors over Christmas. I'll probably, maybe take a walk around Wardown Park with her at a socially distance level, but that's as good as our family Christmas will get. But these sacrifices shouldn't be seen in vain. They should be seen as, a positive future that we can all spend together for many years to come.
Indeed, definitely. The sacrifices are needed at this time more than ever. Baz, your positive message.
I'll take more than 3 minutes. I keep saying to all my colleagues, at the practice, and all the colleagues that have, I come across, this is a unique time in our working life. We will never, hopefully, never see anything like this again. So, whilst things have been extremely hard, it's also been a pleasure to be involved with things like the COVID hub, things like the COVID vaccination. So it's been a unique experience. The positive message, I think, is that I think there is light at the end of the tunnel, and I think I've given the family permission to say let's start booking some holidays.
Indeed, indeed, and definitely, definitely. It's always we have to keep ourselves safe, and definitely there's a light end of this tunnel. And on that note, I must say, this is the time of festive season, and this is the last show, last live show of the year. I know I also have 2 more weeks to go, and there will be recorded shows, but this is the last live show for the year, and I can't have better guests than both of you. So thank you so much for being part of this show, and thank you so much for being lovely guest for our show tonight. Thank you, Baz. Thank you, Coach.
Thank
So
you so much.
so that's all for tonight, guys. If you I hope that you all have enjoyed the day, enjoyed the show, and if there's any questions in regard to the show, please get in touch with us later on as well. Until next time, I'm your host Fahad Matin saying assalamu alaikum.